Molly. I'm going to be performing the IV piggyback. I'm going to be using Rosefrin. It's an antibiotic for an infection. Side effects are nausea, vomiting, seizures, and Stevens-Johnson syndrome. A contradiction, it would be a hypersensitivity to cephalosporin. I would assess the patient's infection. I would make sure to obtain a culture and sensitivity before administering the antibiotic. And I would also make sure I check the patient's history for any allergic reactions to penicillins. And the recommended dose for Rosefrin is 1 to 2 grams every 12 to 24 hours. The doctor has ordered 2 grams every 12 hours. What I have is 1 gram per 1 ml. I'm going to go ahead and draw 1 ml of my Rosefrin. I'm going to apply my aseptic technique by alcohol swabbing the top of my medication. And I'm going to place 1 ml of air into the Rosefrin and go ahead and draw 1 ml. Now I am going to go ahead and alcohol swab my mini bag and insert my 1 ml of Rosefrin. Once that's done, I would go ahead and place my needle in a sharps container. Now I'm going to go ahead and just mix the medicine just a little, and go ahead and label my mini bag with the patient's name, the drug, the dose, the time, and my initials. Now that that's ready, I'm going to go ahead and I've checked the integrity of my tubing for my piggyback, and the expiration date is still good. I'm going to go ahead and uncap my needles and uncap this tube. I'm still going to go ahead and apply a sensitive technique anyways. Now that that's ready, I'm going to insert. And now I could go ahead and I could, well, that's primed. I have drips, so now that I'm all ready, primed, medication's labeled, I'm just going to also label my tubing with the date, time, and my initials. I have my medication prepared. And I'm also going to need my piggyback bar, and all set to enter the patient's room. At this time, I'm going to enter the patient's room, ask them their name, date of birth, make sure, check their allergies. I'm going to perform my hand hygiene and apply gloves. At this time, I'm also going to inspect the IV insertion site, make sure there's no signs of infection, phlebotomist, or infiltration, and it looks good. All right. Now that my gloves are applied, I am going to go ahead and inform the patient that they're getting Rosefrin for an infection. To hang my piggyback is actually higher than the primary, which is here. So the primary is lower than my piggyback, and before I go ahead and attach the piggyback, I'm going to go ahead and clamp the normal saline, which is currently running. And clamped tubing as well as the connected tube. Now that those are clamped, I can go ahead and apply my piggyback. I'm going to perform aseptic technique by taking off this cap and wiping there as well as over here. Now that I have an alcohol spot there, I can connect my tubing. Once that is attached, I can set my drip factor, which is I have 50 ml bags for over 30 minutes times 10 drops, so it's going to be dripping for 17 drops a minute. Here's my clamp, and I'm going to count that minute out for that 17 drops to ensure the medication. Once I am sure that the medication drops are as prescribed, I can then go ahead and unclamp the connector tube, and I can now unclamp the normal saline from the primary. Once that's unclamped, I can assure that this is dripping as well. Now that is all set up, I would go ahead and document the date, time, the drug, the dosage, the input and output. But before I go ahead and do that, I would come back into the room, reapply new gloves, and take off the bag. And after an hour, I will come and I will disconnect my when I disconnect the finished medication, right before I do that, I want to make sure everything, this medication is still clamped off at both sides of clamping, the connector and the tubing. And I'm going to recap anything which is uncapped. Now that the medication is done, I can go ahead and do the doctor's order from the primary normal saline, which was dripping at 50 ml. 50 drops per minute, so I just want to go ahead and make sure the primary is back as ordered. Once I assured that, I can go ahead and clamp this site as well, and I could assess the insertion site, and I could ask the patient how they're doing, and I could go ahead and document with my MAR the date, time, my initials, the medication from the piggyback. I could document that I put back the primary to its original drop factor, and the 4Ps, which the patient's pain, position, that to go to the bathroom, and the position of them.